Welcome everyone, and thank you so much for joining us. We actually started 1 minute early today so that we could get everybody time to get on. So we are super excited that you're here to join us, and I can't wait we have a lot of really good information today, right, Chuck?
Absolutely.
So I'm going to go ahead and just cover a little bit of the CEs. I'll also talk a little bit at the ends in case you're coming on late. But number one, it's really important that when you log on to when you registered for the CE, that you registered in your legal name. And what I mean by that is the name that's on your license. That's really going to be important when you receive your certificate. And also, if you registered, you must make sure that you sign in on your own device so that we can see that you're on. Very important. Now, if you log in on your phone and you go in through the Zoom link, you're absolutely fine. However, if you log in on your phone and you dial in and you hit the number where you're listening, we cannot see who's on. So we're going to ask that you please make sure that you send me your name, the title of today's course, and your telephone number so that we can cross-reference that and make sure that we give you the CE that you have coming. Again, it takes about 30 days to receive the CE. And I'm going to tell you, there'll be a slide at the end where you send that information to, but I'm going to go ahead and tell you that it's going to be practicecoaching@benco.com. Again, that's practicecoaching@benco.com. So if you are dialing in on your phone and you need to share that information with us, please email me at practicecoaching@benco.com. And again, it takes about 30 days to receive your CEs, but please be patient. If for some reason you don't receive your CEs, let us know and we will make sure that we get that to you. Also, you're going to be receiving a survey. We really want to know how we're doing. We want to know what you need out there to stay safe and how can we help you, because that's what we're here for. So please make sure you fill out that survey and give us some good information and some good feedback about how we can better service you. We really want to do that. So with that being said, I'm super excited to introduce I always say my amazing boss, because he's absolutely amazing. I think he's one of the biggest leaders in the dental field today. If there's something new out there, he's learning it, and he's making sure that we take good care of our customers and stay on top of it. So with that being said, I'd like to introduce my boss, the Managing Director of Benco Dental, Chuck Cohen.
Thank you, Kay. Nice to see everybody today. Thank you very much for being here. We have one of our most exciting and most interesting programs scheduled for today. You're going to hear from Paul Jackson, longtime Chief Marketing Officer at Benco Dental, former service tech, former sales rep, all-around dental guy, and he is going to talk about COVID-19 testing. He now has a very interesting position at Benco. He is our principal researcher, and his job is to look for new products and new services that we can bring to our customers, and he is our resident expert on the topic of testing. So I'll kick things off by turning it over to Paul. Thank you very much for being here today, and have a great program.
Thank you, Chuck. And so, as Chuck said, been in dental for a long time, actually almost 45 years total in dental. And with that, almost 25 at Benco. So that's a privilege to be there and to look for new products. I love dentistry, and what dentistry can do, for patients and change people's lives. And so anything that Benco can offer and help our dentists actually implement procedures and products, that's really been fun. I will start off a little bit that, as I have done all these slides, you should be looking and following the CDC and the ADA recommendations. They are changing, and I would say, monthly to weekly. And so I think it's important to stay, current with what is the recommendation and regulations around testing, especially. And so also too, I'm going to talk about a couple of things, but I'm being apolitical these days, and just trying to bring up the facts and the information so that you can make a decision and manage your practices. And so I have a lot to share. If you are in a place where you can take pictures, I have a couple QR codes so that you can actually go to the site. And so the topic of today's webinar is testing and what you need to know now. And there's been a lot of things that have changed just in the last 20 days. First off, the whole, change with the number of cases and the surging all around the country. And so that I think a lot more people are interested. We thought this was kind of waning, or, we sort of had control, but now the cases have increased. And there's more new antigen tests in the line or being offered. And so that's changing some things too in the tools that you would have to test in your practice. And then there's also some controversy around PCR testing. So COVID-19, some of this is going to be basic for you, but it's a virulent respiratory disease, illness. And for those who've been around, like Chuck and I, more than 20, 25 years, it's not unlike AIDS in that it's affected our practices, but it's different than AIDS. But AIDS was a bloodborne pathogen, so it's easier to trace, easier to track, and easier to understand. The mortality rate, still 0.66, mostly affecting people over 80 years old. And unfortunately, people in nursing homes, 39–40% of the brunt of this illness. And the two things that we're really going to focus on here that will help you is patients are more infectious soon after exposure, but it's before symptoms show and often before any tests can detect the virus. And then also, there's a lot of patients that are just asymptomatic. And so that's why the R naught is unknown. And so you say to me, what is the R naught? And I thought we're talking about testing here. Well, it's important. And so reason is first off, what is R naught? And so it's how easily the virus is spread from person to person. And so we don't know what that is currently. And the reason is because of the asymptomatic people. And so if it's fewer people that have it, but we're getting a lot of spread, then the R naught's going to be a lot higher. If there's so many people that are asymptomatic and it's really not spread that easily, then the R naught's lower. And so you look at something like measles, somebody walked into a room that had measles, and there's people that have not had it or not protected. Just being in the room, they're going to get it. And so, whereas COVID-19 is somewhere between 1.4 to 5.7, and why that's important is whatever the R naught is, then that is going to affect the herd immunity. And so, don't think about herd immunity, in the political sense, but herd immunity is going to be very important for the vaccine. And so, if you take the number of people that have had the virus and then people that get the vaccine, you're going to get some percentage of the population. And so if the R naught is 1.4, then it's going to be closer, to the 40% of the population will give us, a time where we don't have to so focus on this COVID and how it's really affecting our economy and our practices. Just a curiosity, you might look at North and South Dakota, Iowa, and Wisconsin. They might even reach herd immunity or somewhere close to it even before the vaccine. And so now to testing. And so specifically, I want to use two cases that we all are pretty familiar with. One of them is Elon Musk and his test when he got COVID, and the White House and the spread that they had, and our president actually getting, COVID. And so in the case, just quickly, with Musk, he wasn't feeling well, went and had a test, and he says, well, let me have another test. And so he ended up having 4 tests. 2 of them were positive and 2 of them were negative. And he says, these tests are bogus. He doesn't believe them. And so they were antigen tests. And so antigen tests, and we'll cover this a little bit, they do have, a slight weakness that when someone is in the beginning of the virus, when the detection level is low, they might actually show that someone doesn't have the virus. And so when I heard about Elon getting 4 tests and that, I knew that he really had the virus. And in the case of the White House, they had a strategy. And so they're smarter and more planned out than all of us, and they have more resources. And so they were taking the Abbott ID Now test which is a 15-minute PCR test. And they were testing people that were coming to the White House. And so in that way, they were protecting. But as we'll discover, there's a little bit of a hole in that strategy. And so this is the Journal of the American Medical Association chart. So it's really helpful. If you can, try to memorize it. And specifically, it's showing, when a typical patient, this is not, so different patients could be higher or lower on this scale, but a typical patient and how the infection progresses. And so you have an exposure, and then there's a period of time. And then during that period of time, though, it says detection is unlikely. So no test, no PCR test, no antigen, no test would show that the patient is infectious. And so this red line is showing typically when someone would be shedding the virus. And so you can see here that it's possibly up to a week before even a PCR test would have enough virus that they can detect, during a PCR test that the patient has the virus. And so that's really one of the biggest problems with this coronavirus, is you actually have people that are infected, they don't have any symptoms, and so they're not showing any symptoms, and the PCR test doesn't show. And so no test can show if the person's infected. And then, so after, usually it's around 5 days, PCR is sensitive enough to pick up the virus and show. And so that's why it's really important, in questioning your patients to find out if they have any symptoms. And so, and I also have included the QR code here. It's Anthony Kuster. He's a doctor of public health in a university. And so he has a real good explanation of PCR testing and its sensitivity. And so, how do you know how COVID-19 is transmitted? We know droplet, and because we're dentists, we know aerosol. And so how long is a person infectious? And that's quite a debate right now. And then and what is the strategy, for your office? And so Dr. Milna, and there's another QR code there from a press conference that he did, it's at Harvard. And so really goes through the explanation of it. But what he used as an example, and I think it's really a good example, is he talks about Swiss cheese. And he says, if you pull up one piece of Swiss cheese, you can see through it, and it's lots of places that you can see. And he says, what a good strategy would be when you take multiple pieces of Swiss cheese, it actually turns where you can't see any, light through it. And so that was really the problem with the White House, is they had one strategy. And so that one strategy fell apart. But if they were practicing testing with masks, with hand washing, with staying a distance apart, it would have been a great strategy. And so what is the strategy that you want to incorporate in your practice? And so this is a slide from the ADA. It's a September survey, early in September, and asking your colleagues, are you interested in testing? And so this could be part of your strategy, is testing in your office. And so this shows, you can see that 44% are extremely interested for testing themselves and their staff members. And it's really important to keep your practice, where you can see your patients. If the practice gets, shut down because one of your staff or yourself, that's not going to help your patients and help your practice. And so you can see, though, that almost 70% of the practices, actually wanted, to do testing in the office. And I would say that could be a strategy. The other is that if you did want to practice testing, once or twice a week, patients we know are reluctant to go, at least some patients are reluctant to go to a dental office. And so anything you can do to explain, what are the procedures to keep your practice, the operatories and, the equipment safe, and what equipment do you have for air and aerosols, but also too, you could, send out information. Our staff has been tested this week and we don't have COVID, and we're going to continue to test and keep you safe. So testing basics, and I'll just spend really just a minute or two on this. And so this is for you to evaluate what tests you might want to bring into your practice. And so you're going to hear terms like sensitivity and specificity. And so those are going to be used a lot. Of course, we all want 100%, sensitivity, 100% specificity, but unfortunately, there's really not any test out there that offers that. And the sensitivity would be, did it identify a patient that has COVID? The specificity would be, does it identify that if someone doesn't have it? And so you don't want people to where the test says, oh, they have it, and then you either send them home and they can't work, or send them home and they can't have the procedure. And so everybody's looking for the highest sensitivity and specificity. And then, why I mentioned, how you sample the patient is, the nasopharyngeal, that is the most used for PCR. And, you see a lot of pictures of it. And I hope, you haven't had this, but if you have, it's not easy. It's quite invasive. It could be a little bit painful. And why this is important to talk about is, if you're going to test you and your staff every week or twice a week, something this invasive is not only uncomfortable for the patient, but it's also uncomfortable for you, to cause that trauma. And so there are nasal, throat, and saliva tests out there, and so they're less invasive and less, more likely that you could do them multiple times in a week or a month. And then serum is the test that would be offered for antibody testing. So the different types of COVID testing, PCR, is a gene molecular test. The RT lamp is also molecular, so like the PCR. Antibody testing, and then there's it's testing usually for both the IgM and the IgG, and then the antigen testing. And so the PCR, what it does is look for a you get a sample, and then it's placed in a lab, and so there takes some time to get to the lab. It takes some time to process, and then to get the results back to you. And so if the test is, it's not, the last PCR test I had personally, it took over a week. And so if a week is how long that it's taking for the test, it's not going to be as relevant. And so that's the weakness of PCR testing. Also too, you can see that they're saying, 2 to 3 days, your best read for a PCR test is going to be, somewhere around 5 days. And so that you'll have sufficient, virus that it can be detected. In the case of, well, and I guess we'll come back to this, is that, looking, you can see that the PCR test is quite sensitive, and it's actually sensitive, weeks into testing and the patient's initial infection. And the big controversy right now is, how long is a person infectious? We're of course interested if they're, if they have the disease, but for our practice and for, our lives, when is a person infectious? When do they need to actually, not, be in quarantine? And the CDC actually just changed this week from 14 days down to 10 days. And you can see, that kind of correlates with this chart here of when a person is actually shedding. And so, and you can see too that the IgG and the IgM antibodies, that's what, is, fighting the virus and, how we begin to heal, you can start to see those in the results. So this is antigen testing. And so antigen testing's been around for a while, but what's happening is it's getting more and more accurate. And so that's why you're hearing more about it. And actually too, what's nice about it is it doesn't measure as long. And so it's more like 10 days to 2 weeks. And so it's more accurately measuring, when a person is infectious. And that's what really, this is a New York Times article, but there's lots of, if you do the research, you'll see there's a lot of people that are talking about antigen testing. And so for the reason that we have here, so it's still looking for the active virus. And then you get the results back in 15 minutes. It's usually a lower nasal swab. The cost is much lower. And there are current tests out there. There's a BD and a Quindel test that are available now. And, it does have the same limitation as a PCR though, that there needs to be sufficient virus present. So, if it's, day 0, day 1, it's likely not to show. And so then there's the antibody testing. You have to have sufficient quantities of antibodies. It does give you quick results. It's just a finger stick. It's past infection. So it does give you some idea, possible immunity. And then there was a lot of poor quality antibody tests, in the past. They're pretty good right now. Again, though, that it's only showing the past. And pharmacists were granted authorization to perform the antibody test. And so, so you can see here, from, where the antibody test would be, important, in the later phase. And so this is a comparison chart to, for everything that I said. But, the PCR and the RT lamp, they're both PCR. This is just a faster one. And so they both showed that you have the active virus. This takes days, 30 minutes, both nasopharyngeal swabs. You need a clinician in the PCR. In office, what you have is a device. And so you take the sample and put it in the machine, and so the machine processes it. And then so it tells you that the patient has the virus. The cost is the PCR's issue. It's over $100. And sometimes you can, show a positive result. So like 2 or 3 weeks later, when the person's not infectious, it could still have a positive PCR. In the case of the RT lamp, it's, has this, it's a little bit less cost, but you can do it in the office, 30 minutes. Antibody testing it shows the past, and it's a blood sample, patients fighting the virus, and it does not reliably detect active virus. And so the antigen testing, it shows that you have the active virus, 15 minutes. We covered that. And then it uses proteins instead of, RNA. And then it shows the patient has the virus. But it's not as accurate as PCR. But the thinking is that if you test, because it's so easy to test and it's inexpensive, that you can test multiple times and you'll still catch the cases. And so possible strategy, and the CDC has some guidelines, your pre-screen visit by phone, temperature check on entering the office, testing the staff. Sorry. And then ask the patient to notify if they have COVID. And so regulations for testing. FDA approved, all the tests that are out there currently are set as complex. And so that means you're going to need a CLIA license. The ADA has been lobbying, to have some exemptions on that. But right now, the ADA is recommending that you apply for your CLIA waived license. And so there's different testing classifications. And so CLIA is, is high to moderate. You need a lab, you need technicians that are working, machines. And so that's not quite appropriate for practices and healthcare offices. CLIA waiver, that is, physician's office, dentist's office, points of care that you could practice in the office, but you still need a license. And so the application is about $180 for 2 years. And we do have QR codes to give you the form. And then there's guidance on how to apply. It's a state issued license, even though the federal government's involved. And so there are new CDT codes, and they will be valid January 1st. But both for the antigen testing and for antibody testing. And that's what I have. I appreciate the time to be with you. I do have, if you wanted to take a picture of this, it does have a link to the 2 videos, as well as the CMS form and the instructions for the CLIA waiver.
So just to keep you updated, please make sure you scan this QR code, and this will take you to our website, which will give you all of the information about our upcoming webinars that we are super excited to share with you. And I just want to let you know, we are going to be doing a rerun of a re-recording that we did for Dr. Fackel, because it was such, it was so well watched and so well received. So we are going to be replaying that on December the 11th, and it's going to be from 1 to 2 Pacific, and we're also going to do it from 4 to 5 Eastern. So please make sure, if you're interested in watching that, by watching the recording, we are going to be on with you. So there'll be a quiz afterwards, but you will be able to receive CEs for that. So super important. If you want to know, just mark that on your calendar. Just be aware that that is going to be a recorded recording that we had done a while back with that doctor. So also on December the 16th, we're going to have Dr. Pearson on, and she's going to be going over opioids, dentistry, and addiction. I got to see this presentation, and it is going to be phenomenal. So please, it's something that you should be aware of as providers, what to look for in your patients, and how to react to it when they come in and you need to have that tough conversation. So please make sure you put that one on your schedule. That's going to be December the 16th, and that's going to be from 7 to 8 p.m. Eastern Time. And then really excited about this. We are going to be doing a workshop. It's going to be this Friday at 4 o'clock. It's going to be myself and Linda Anderson. And we're going to be going over, what do you need to do to close out your year? And what do you need to do to prepare for next year? There's been a lot of changes going on, and we really want to share with you and give you some good guidelines. So if you're interested in joining us on this 2-hour workshop, all you need to do is go to shop.benco.com. Again, that's shop.benco.com, sign up, and we'll get you registered. It's a $49 workshop. You're going to have a workbook. You're going to get to receive 2 CEs. You're not going to want to miss it. So please make sure you sign up today. And with that being said, I told you earlier that I would go over this. If you have any questions about your CEs, or if you called in on your telephone, and I'm not saying logged in, but called in using a telephone number, please make sure that you send me your name, the name of the course, and your telephone number to practicecoaching@benco.com. We also want to know your suggestions. What is it you want to know? What do you need to know to help your office run smoothly? We're here to help you. So please send us those comments again to practicecoaching@benco.com.